And a good day to you. How are you doing? I know it's been a while since we've had a QiRanger report, but here we go again with today's news of the health-related nature. First up, an advisory panel to the Center for Disease Control in Atlanta is recommending that all children range from 6 months to 18 years receive influenza vaccinations every year. Now, on average, the flu infects between 5 and 20% of the population and kills an estimated 36,000 Americans in average years. Now, most of these deaths are among the elderly, but can also affect young children who were previously healthy. Now, the CDC has said that already 22 children have died in the serious flu, and it's actually active in all 50 states. Now, last year, 68 children died in a mild flu season in about 26 states. Now, of those 26 states and 68 children that died, about 90% of the children did not have a flu vaccination. And this brings up a really interesting concept about flu vaccinations because they aren't guaranteed to work, and the flu vaccination is really a best guess as to what types of flu are actually going to be around in a given season. So even getting a vaccination isn't a for sure deterrent from actually obtaining the disease each year. In fact, a lot of people say that they feel more susceptible to flu after getting the vaccination. So it's going to be really interesting to see how this plays out and if this will become another mandatory type injection that kids around the U.S. have to have in order to attend public schools. Also, in flu-related news, 3 Chinese who died of bird flu have been cleared, I guess, of spreading it between humans. Further research by the WHO has confirmed that the bird flu transmitted from sick poultry to these Chinese individuals. This is really important because there is a great concern that bird flu could turn into a worldwide pandemic if it migrates or mutates into a form that can transmit human to human. Right now it's still in the bird to human stage. Now this makes 4 outbreaks of the disease since December in China, and last year it was reported that over 100 individuals in Indonesia had died of bird flu, so it's still a really huge concern. And finally, the U.S. Center for Medicare and Medicaid Services has announced that healthcare spending is about to double by the year 2017 to a grand total of $4 trillion per year. Now that means that our country is going to spend roughly about 20% of our GDP on health-related costs. Now, to give you an idea of why this is such a big issue is that health costs are rising at about 6.7% each year, while our GDP is only rising 4.7%. That means our expenditure for healthcare is rising 2% higher than our earning power. So, hope you enjoyed this little news update. We'll get back in the swing of things soon enough. Have a great day.